Many people who treat their sleep apnea with CPAP have some problems with their mask and machine and CPAP tolerance from time to time. We provided with you a troubleshooting guide for CPAP on our website. If you're getting a lot of dryness, we want you to consider a couple of the following changes. Increase the humidity setting to a higher level, or add an inline climate control or heated hose to your equipment. You'll need an order for the heated hose if your machine doesn't come with it already. To help with dryness, we also want you to ask if there are a lot of leaks going on with your mask. If you're having a lot of leak, there's a lot of air that escapes and there's more dryness. So we want to get you a better mask or take care of the leaks. We want to change mask to a full face mask or add a chin strap if your mouth is coming open at night. If your mouth is open at night, there's going to be a lot of dryness. There are some mouthwashes that we can use before we go to sleep that'll help prevent dryness. That's called Biotene or Stay Moist mouthwash. They make a toothpaste, an ointment that you can spread a little bit on your tongue and swirl it around your mouth. If you're having a lot of nose dryness, we certainly want you to increase your humidity as the first thing to do, but then we can start talking about some saline rinses. And now over-the-counter Flonase is available, and the Flonase can help with dryness as well as congestion. We also want to review your medications. Sometimes medications cause a lot of dryness of our nose and mouth at night. If you're having a lot of trouble with nasal congestion or stuffiness, then we want you to consider increasing your humidification or starting a nasal spray like the over-the-counter Flonase or using the saline rinse. If there's a lot of congestion that's due to allergies, we certainly want the nasal spray, but also consider an antihistamine such as an over-the-counter Zyrtec or Claritin. If you're having a lot of insomnia, we want you to know that some of these may be normal natural awakens in a normal natural cycle, so just relax, hit your ramp button, readjust your mask, and go back to sleep. I'd also ask you if it's caused by anything else, if you're having a lot of urination problems at night or pain at night or other things that is disrupting your sleep. So also analyze your sleep environment and try to optimize it, whether it's noise or light or temperature. If you're having a lot of insomnia, then adding melatonin, 1 milligram, about 30 minutes before you go to bed, consistently will help kind of improve your sleep quality and consolidation. A lot of times we're having trouble on our CPAP machine because of a mask leak. There are many new masks on the market, so I always want you to be aggressive with your durable medical equipment company to see what's the best mask out there for you. And also I want you to know that the best mask this month may be different next month. So you have to get replacement of gaskets or new seals on your mask to make it work better. If you're having trouble because of position at night and the pillow pushing your mask off, then you'll want to get a CPAP contour pillow. It's a foam pillow that's manufactured with little cutouts in it, so you can have the pillow on your cheek, but the pillow is not going to push on your mask or displace your mask at night. There's actually a little cutout in that pillow that you can sleep face down, such as it's almost like a massage table cutout that you can have your mask down and you can sleep on your belly. When you're having a lot of trouble with mask leak, I want you to focus on the mask fit and replacing those gaskets though. Some men find out that their mask is less, if their leak is less, if they shave at night and get rid of stubble or their beard. Some people do quite well, even with a full beard and mustache. They have a leak, but it's a consistent leak that their machine makes up for, and they tolerate it. So not everyone has to shave. You want to make sure at night you keep all the oils and creams and lotions off your face in the area of where the gasket is. And then if you're having a large leak or if you're getting any redness or dermatitis from your mask, you'll want to talk to your doctor about using a Ramsey's gasket. It's kind of a cloth gasket or barrier that goes between the mask and you to really help reduce leaks but also reduce dermatitis. Many of us on a CPAP machine feel the pressure is too high. When the pressure is too high, we know that we want to treat you with the right pressure to keep your airway open all night. In some people, that's a very high pressure. If we turn the pressure down, then we're not going to treat you completely. So it's a balance between being able to use the right treatment and being able to tolerate the right treatment. In order to decrease your pressure or optimize that feeling, we try to help the nose get less congested. So we'd have you treat your allergies and congestions. We'd readjust your ramp feature. We would consider adjusting the pressures a little bit to get you more used to it, or we can switch to a bi-level mode or an auto CPAP machine that may minimize the pressure at times that it can be minimized. Sometimes surgeries are successful at reducing the pressure needs at night, so many people with pressure intolerance do much better when they have a nasal surgery or an ear, nose, and throat surgery, and then they don't need as much pressure to treat their sleep apnea. We want to make sure that you're always kind of aligned with your durable medical equipment company and getting updated mass supplies equipment, re-education when you need, and then new orders whenever you need them from us.